inclusive of workforce inclusive of different background and natural origins, which means gender, socioeconomics, cultural diversity, and even beyond. On the second point of encouraging equal access and involvement of women in technology, if you look at the health industry, the health workforce comprises of 70% of women as healthcare providers. Therefore, there is need to close the tech access and usage gap through programs that motivate women to join. This means coming up with classes and sessions specifically targeting girls and women. Number two, create a safe environment in the digital space suitable for women and access, for women to access and operate. I think with the safe space is just a place where women become comfortable to actually just access and operate, because I know mostly in the information technology world, there's too much hacking, too much what is it called? If you can put it as cookies that actually just so many people are afraid of. So if we can create a safe space for someone to just access and operate and be free to actually just, sorry? If someone is saying something?
No, sorry, you can continue.
Okay, so if we can have a space where we know that it's a safe space for us to operate, then it becomes very easy to encourage women to get involved. Empower women to get involved in creation of technology, digital technology. This will help in recognizing and encouraging women not only to be users, because as of now, mostly we are end users, but also as developers and creators, and we lead to women practicing and getting more involved in the technology space. Having inspiring figures and role models will help attract more women. So if us as women be on the lead and take this challenge and get involved in the digital health, it becomes easier for us to actually just preach it to the rest of the world, because if we have role models and inspiring figures taking up the challenge, then it becomes easy for the rest of the world to follow. As women, we should make intentional effort to make our peers feel welcomed and included in the field. So yeah, encouraging other women to take up to join the industry, just join the digital health, because it's a drive that we need to take as a team. And then working and networking with communities where women can exchange experience, knowledge, and opportunities. This would be a big area, because with personal experiences and networking, it's easier to actually just share the experiences that you have, the knowledge that you know, and also even the opportunities that are available in the field to just help women join the digital health. If anyone has a question, please, or anything is not making sense, just stop me and ask, so that I don't move alone. Is it clear up to there?
We are with you, Tabitha.
Okay, thank you. And then champion for gender equality. This will help in making sure that the decisions made, opportunities that are being offered, or the treatment is not based on gender, but on capability and ability of someone. And this is according to SDG 5, which focuses on pursuing the main goal of sustaining gender equality, which includes ending gender disparity, that is equal treatment, eliminating early and forced marriages. This is something that would actually just help a lot of communities, because I know that even at this year and age, the time, there are still some cases that are happening. Securing equal participation and opportunities at work, such a manner that when there's a position that comes in, then women are equally capable of getting the opportunities and even participating. Ensuring participation and leadership in decision making, also involvement in the decision making, just to make sure that we as women are equipped and participate in the decision making processes. And then ensure universal access to sexual and reproductive health and rights. I think we can have a chance of having these discussions more because of just us women taking charge of leadership and also in the digital space. I think my presentation ends there. It was a short one, just to highlight the main points, but I'll finish with the African proverb that say, if you want to go fast, then you go alone, but if you want to go far, then you go together. So I believe that in life, if you go alone, yes, you'll go faster, but if you go together, then it becomes easier to just have, you form a movement, and it has a bigger impact at the end of the day, because the number of people that are learning in the process and coming in is much bigger than doing it alone. So it becomes easier to do something if we come together as a team. That would be all. And I will take it back to Marion.
Okay, thank you, Tabitha, for your amazing presentation. And Tabitha, just to mention, she's part of the Youth Voices Network. So it's actually very great to have one of the members of the network sharing her perspectives on this subject. So in case you have any questions for Tabitha, you can feel free to raise your hand or type it in the chat box so that she can take the questions. Just to move forward. So our next speaker will be Winnie Wangari from Vilgro Africa. Winnie?
Yes, Marion, how are you?
I'm fine.
Yes, how is everyone? How is the evening coming along?
For me, well, it's great. I'm happy to be in this forum and to listen to your insights. Yeah.
Yeah. As to this is the engagement of the day, I feel like it should be like more of a conversational engagement, to feel the need of understanding how the impact of women come in play. So I think I'll discuss that further in my presentation as I share. So let me have it in full mode. Right. So I'm Winnie Wangari Kibiru. I'm actually the technical analyst at Vilgro Africa. I'm able to understand or take the path of the current innovators we incubate at Vilgro Africa, understanding their end users and understanding the level at which they are required to have a product in the market and the length at which they need to understand specifically the users who are going to do this. And these topics actually that attaches more on the women is very crucial. And in Africa itself, women are frequently take the lead in the healthcare. You'll find them in every hospital, you'll find them in every level of healthcare providers or healthcare innovation system that they will be involved at. Those are the kind of the first primary users most innovators always think about. So due to this role that they play as the primary care givers for their families, within these insights, women can control or contribute significantly, right, to identify and addressing healthcare issues, because they're the ones who are able to directly understand and directly intervene the problems and understand very well how the solution can come and play a role to make their healthcare systems or healthcare services having addressed their current or their primary problem is very important. Having understood that so many innovations, so many services in the healthcare are actually directed more in women, like understanding, for instances, from the maternal all the way to the childbirth, all the way to having a very good safe birth. There's so many in the healthcare providers, innovation has come around that. And it's so disturbing that most of these innovation or services around this are actually built for women, but understood by men. So that is very crucial. That's why I emphasize that the women who are actually in this environment can be able to contribute and address these healthcare issues because they understand they are within that environment. They address these problems every time now and then, and collaborating very well with other women can also utilize their knowledge and skills. So we have women in technology that do not have a very much understanding in their innovation. So the women who do go through these different insights and experiences to identify the healthcare issues in our own environment can very well work together with collaborating very closely with women who can take their technology, their innovation to a different road, understanding and applying their knowledge and skills to that. So developing very creative solutions is very, very crucial. Giving an example, having said that men have innovations that are actually problems addressed more in the women. So the women are required to leverage the knowledge they have, to leverage the problems that they are currently facing, and provide insights into the innovation and around the new technology they can address, and understanding, okay, so maybe if a woman does not know the technology or the way to go about it, so they could be able to actually work together with a team that is able to actually bring in their business aspect, their financial aspect, their technology aspect, because of course, the previous speaker mentioned about having different people come in and play a role. It's very, very important. So moving to now where our crucial topic is on fostering innovation. In order to promote innovation itself, we need to understand the environment of the problem. So that's where, having talked about women to understand and have gone through different stages, there could be a problem that has stage 1, stage 2, stage 3. They have gone through all those different stages of their problem. So it's good to understand the environment. It happens anywhere, at any level in healthcare and medicine. So so you are not basically limited to innovation around a device or innovation around providing a service. There could be an innovation comes in terms of a laboratory experiment. There could be an innovation that could come around operating rooms, like, is there a specific problem that women face in the operating room? So this does not specifically address, like, the users can be different aspects and different forms. There could be the one who is actually being the patient themselves. How will they innovate a way to, like, reduce the problems that they currently have? It could be as well a solution that is addressed to the actual practitioner who is in that kind of environment as well. So innovation basically must be cultivated, as mentioned before, and by teaching it, by creating space and supporting it, and also providing opportunity for implementation. So providing opportunity for implementation, you need to actually consider strategically humbling yourself towards the stakeholders. So stakeholders will be the frontline workers, nurses, doctors, surgeons, or the laboratory people who are supposed to help you with this, Will it just be about the patient themselves who have these different levels of the problem that they are currently facing, and there is no technology or there is no medicine or medical device that has come in and be able to do this? And then you also need to humble yourself with the investors. So having understood what your problem is, having directed or redefined your solution to a level that is investable ready. Giving an example, having a medical device that is functional, has a performance that is acceptable, has addressed the technology that you're trying to solve the problem, and has been captured very well. And this will be able to give you a very good, even product environment that will be able to accept. So having understood your product environment, having taken consideration of all the support staff that will be required of you to come in and understand how you're going to build this problem, then the investors will be able to understand better. So you are required to be very humble. And with the experience that I've been able to consult in our medical device, in the medtech space, is that this product tend to take long time to go to market. Why? Is because some of those innovators have not been humble enough to understand their end user, to understand the product environment of which this product is going to have and take place. And one of the most important definition of having a very good fostering innovation that women can actually take up on is the taking advantage of the emerging technology. You might not be aware of all the emerging technology, but we have the opportunity and space to teach ourselves, to understand and collaborate with other innovators. So it could be like you're coming up with an innovator that can actually collaborate with other innovators, which can be a very good emphasis on how women can come up together. I know this is part whereby in Pan-African, in understanding the innovation, that is something that is still coming up, still being developed, and women are coming out of their comfort zone to understand how am I going to address this problem that I am facing as well. So having to understand the whole uptake for fostering innovation, understanding your solution shop is coming up of a product. You know, you might have a problem that has so many solutions in it. So you have to be innovative. Your technology has to be distinct in a way that it's either you're improvising the current device or the current solution is in the market, or you're actually coming up with a new technology or a new innovation that has captured the current emerging technology. So there's two distinct approaches to improve efficiency and outcomes of care delivery. So there's the ideal of diagnostic and dilemmas that even women can look into, and standardizing those care pathways as part of innovation. So it doesn't have to be like a product or anything like that. It can be like even providing services, whether it's different levels of healthcare systems that are needed within this environment we currently have here in Pan-African, or just here in Kenya, that you will be able to streamline those processes. Maybe there's a process within the Ministry of Health that you want to innovate, or maybe it's a system within the health clinic that you currently are able to understand the problems and you want to actually reduce the availability to actually increase quality of healthcare services as you would want to tend to have. So those are those different ways in which women can actually emphasize on it, because they are actually the primary givers or the primary problem receivers of these healthcare providers. So one important key is actually the business. So you have the actual innovation, you understand the problem, you understand the solution, you know your end user of how they are thinking about reducing the problem or improving the quality of healthcare, which is very important as well. You need to understand, how am I going to actually make a business out of this? Because it's very crucial, because most innovators will just have an idea and come up with the problem solution. Here it is, it's practical, right? But there's no business idea in it. And it's very crucial, because as you develop these solutions, you need to actually understand, how am I going to make revenue out of this? Because you've already understood your problem statement, you already understood what your solution statement is all about. You already have a product, and then you are stuck. So where does it go after that, right? You actually need to understand your business take up after it. That is for any innovator who comes into this kind of business. You know, if you're not a business-minded person, you can actually have a good team that can come in and understand how they can take up that business. Even though you are in the innovation, your mind is all about the innovation. That's one way you can look at it. The other way you can look at it in terms of when you're building up this innovation is actually to understand the plan, right? You've gone through the technology, you've implemented the technology in your innovation or not, or just improvising whatever is in the market, but you need to come up with a precise business direction or agenda to it, right? So, so business innovation basically will be regarding to the implementation of how this new innovation and solution will improve the productivity, the efficient and competence. So of course, there will be the competitive aspect of your product, imagining that there's a product in market and you're improvising that product, right? That can be a competitive loophole that you need to understand. One way you can look at it as a part of a competitiveness is that you might be the first innovator of this solution or innovation in that technology, but there could be someone else in mind in future who can come in and challenge your innovation or your business. So it's very good to actually understand how your business can be. You might not have a very unique technology, but you actually, the way you take your business and vision it in a way that you have a plan on how you're going to make revenue, that is where the investors are very insightful about to come and just provide their funds to help you build up on your business, right? The investors will come in and help understand, okay, you have a product, you have an innovation, but will there be any revenue after that? It should be clear that your innovation does not have to stick you not to being a business venture. After all, keep in mind that business for healthcare provided will be treated differently. So innovations actually in the healthcare provided will be treated differently from any other type of a business. And the path to actually have a product, a medical product in the market is actually very crucial. And having to understand that in our country itself or in our Pan-African itself, we do not have that regular, seamless pathway for it, right? If a company has this product and wants to market it in Kenya or in Uganda or anywhere else in this Africa, they actually have to they have to get certification from internationally recognized, whether it's the CE marking or FDA marking or going to the Asian marking, get that certification level. That's why when I talk about the healthcare provider business mindset will be treated differently. So having understood your technology very well and coming up with the innovation that has a successful business model that will really work, and having a plan and a vision towards that and making that successfully will give you a very good qualitative venturing into a variable product that is acceptable in the market. And that will be all for my presentation. So Marion, over to you.
Thank you so much, Winnie, for that. I think one thing that has just occurred to me is the fact that you mentioned most innovation. The primary receivers are women, but they're built for women and understood by men. So I think
Yes.
it really speaks to the need to enlighten women who are actually the receivers of this. And before I take up any questions, I think I'd like to welcome Dr. Marie-Claire to give her presentation. Then we can now get into the Q&A session. Dr. Marie-Claire, you're welcome. She's here courtesy of Women in Global Health. So I think she'll be able to.
Yeah, thank you, Marion. Just confirm that you can hear me.
Yes, I can hear you.
All right, fantastic. So yes, I like the segue you've given, which is health is made by women but led by men, and that's why I'm here this evening or afternoon, whatever time you're watching, hearing this webinar, to talk about Women in Global Health, which is a non-governmental organization based in the US with chapters across the world, with an overarching aim of challenging power and privilege for gender equity in health. So Women in Global Health, in a nutshell, as I've said, it was started in 2015 and is now an NGO that's fully registered. For the students here, just like to tell you how the power of the things you do in undergraduate leads you to come up with great ideas, because the founder of Women in Global Health was the first female, I could say, president. And she noticed soon after transitioning, when she was in her residency, that every global health event had the same faces, and it was very few female faces. So while at a lunch table in Geneva around 2015, they decided to be doing mapping of how many women attend World Health Assemblies. And to date, we have about 70,000 supporters, about 40 official chapters, of which the Kenya chapter is one of them, that was started in 2021 October. And there are about 20 more in pipeline. And out of all of these, 55% are in low middle income countries. And I think just to make it easier for you to see, this is especially if you can see the African continent has a good number of these chapters, and it's still growing. So Africa region actually houses 40% of the chapters, which is a reassuring thing. And in East Africa, I think it's only 3 countries that are left that don't have a chapter. So there's a very strong presence. And I think the one thing it does is it looks at things from one, power and privilege, and then it tries to look at those people who are left out of the dialogue to create the social change. And it tries to do this at national, regional, and global level. So people are free to sign up on the website, womengh.org, for the weekly newsletters and get updates to see how these efforts happen. And it just mainly happens through mobilizing people to be a community where you're advocating for this. It's not only women, we also have male allies, because men form 70% men form majority of the leadership. That's about, and women are 70% of the workforce, but only 20% are actually in leadership. And it's even worse when you look at the global organizations, which can even get lower and lower. And that's why it's so important. And this data will even be further broken down from the Kenyan lens on the 16th of March, when the Women in Global Health releases a report called She Shapes, where Kenya was one of the participating countries. I can tell you, because it's already something that's publicized on our social media channels, some organizations, the representation was so bad that they've had to appoint a gender officer to see what is the issue. Is it the women don't have a conducive environment to vie, or the electorate is not giving them the avenue to be elected into leadership? Whereas other organizations, I can talk about Kenya Medical Association, where I'm a member, we have a reverse situation where, like the Young Doctors Network, we've never had a male co-convener, not because they've not applied, but just because for one reason or another, they're not attracted to the network to apply for the convenership. And it's only until this year where we had the first time a few more male applicants than female for the replacement of the co-convener. But even then, the applicants for the male applicants were a bit lagging behind, probably internship just fresh from med school compared to the female candidates. So what can we do to bridge that gap and collaborate? And this is just in a nutshell how we look at things from an individual person to interpersonal factors like sexual harassment. There was a report called HATU that was going around, and it's still going around, where people were giving anonymous feedback on how they've gotten or experienced sexual exploitation, abuse, and harassment. Looking also at community factors, a huge proportion of the community health workers or volunteers, depending on which country you're from, are women, mostly, as most of these women are senior and they are not paid. And that's quite unfortunate. And I know the Kenyan government has committed to be paying them, but it's a matter of when will it happen, because it's always made all these commitments. And I think this is just generally how we go about it. What are we tackling? We want to tackle people being gender blind. I think 3 weeks ago, there was a webinar by Knowledge Success on postpartum hemorrhage, and it was a panel. A panel is an all-male panel. That should not be the case, because actually the joke that was going around on Twitter is which of these people have a uterus. I know things have changed, but I mean, so now even the counter was like, if you're going to do this, if this is going to proceed as is, then women should do a panel, that's a female panel on prostate cancer or vasectomies, the effect of vasectomies. Fortunately, that organization acknowledged their mistake and said they'll work on it, and I think they did. So how do we change? How do we go from gender blind, gender exploitative to being gender aware, which is now the middle ground, finally accommodating, and the best part is now transforming. And again, I think we have commitment, because even our Ministry of Public Service and Youth has now changed to be Public Service Youth and Gender Affirmative Action. So it's now a question of when are we going to work on this particular issue. And if you're looking at from a health workforce perspective, these are the SDGs that are commonly affected. So even as a young healthcare worker, whether in undergraduate training, postgraduate training, or even working now, health is not just the SDG number 3 of good health. Health is, I say this quote, does health give you wealth, or is wealth health? And it's sort of like a symbiosis, because if you don't have money to maintain your health, then that's a tricky situation. If you don't have decent work and the economy is not favorable to get the healthcare you need, even paying that 500 shillings of NHIF will be a huge challenge. And this is now where the quote that Marion has just said, it came from, because it was actually a report done by Women in Global Health in collaboration with the Global Health Workforce Network and World Health Organization, that looked at how women is primarily mostly delivered by women, but just led by men. And that really affects even how the policies are made. Today at the Africa Health Agenda International Conference, the AMREF Group CEO said that policymakers are more dangerous and are more likely to kill you than your person who sells firearms. And that is literally how health is shaped, unfortunately. Unless you change the narrative and unless you make sure people know the importance of some of these things not being addressed, then we're going to be always running catch up. And this, I think, is, I just want to jump to impact in a nutshell, which one of the key things when you're talking about technology is a couple of us are creative, a couple of us have social media. How are we using this social media in our communications? And there are a lot of ways you can do this. You can either write, if you have a blog, how about taking your blog and highlighting an issue on how gender equity has affected you? There is International Women's Day and it talks about embrace equity. I'm sure all of us in this webinar have a story on how equity has affected us. If you're bold enough and you have a couple of skills, and it's something we had done as a chapter on training people on communications and writing opinion pieces, then write a piece for the newspaper. I think more and more as we keep going on with life. There's a lot of mis and disinformation going out there. And it is those of us who are in health, who interact with these things day in, day out, that can change the narrative and make people more aware of why it's important to invest in technology, to invest in women, and to invest in health. And then, of course, there are the various gender equity healthcare workforce features, and Women in Global Health has quite a number of reports on that. So with all that I've said, now we are talking about cracking the code, and I'm sure you're wondering why this theme was chosen. It's because currently, throughout this week, there's been the Commission for the Status of Women, which is normally a meeting at the United Nations headquarters in New York, which just breaks down issues affecting women. And this year's theme is on innovation and technological change and education in the digital age. How can we use technology to progress us to gender equality? And Women in Global Health, during the middle of COVID, around late 2021, they held an digital innovation and artificial intelligence challenge focusing on women, COVID-19 and digital health. And it was sponsored by Novartis and the Novartis Foundation. And all these countries took part. So it was a global competition. However, only 6 countries got to the end, and Kenya had a candidate that got to the end and was number 2. The other countries, which is reassuring to see, is half of these countries were based in Africa. So it was Nigeria, South Africa, and Kenya. And if you're looking at it from a technology lens, these countries are actually some of the countries that are pretty progressed and advanced in their data protection and digital health landscape. A country like South Africa had their digital health policy as early as 1999, 1996. Kenya just passed its Data Protection Act, I think late last year, give or take. And if you've noticed, there are a couple of private facilities and even like the Kenya Association of Private Hospitals that have been doing numerous webinars on how to store data that you collect from a patient, because the data you collect from a patient is very important. It can actually shape the decisions you make as a hospital, as a community. But that data, there's ways that you have to, 1, collect it in an ethical way, 2, store that data, and when a particular timeline comes, it should be discarded in also a safe way so that people don't just go picking information and probably unleashing it on media as part of cyberbullying, which has happened in especially the US. This is things that are happening. I think almost every other month or day I hear how hospitals in the US are held at ransom just to, their systems are electronic and people hack and pull their systems at ransom, which is a huge risk. It's of course not a problem we are facing now as a country, but it's just a matter of when will it happen. And that's why you have offices like that one of the Data Protection Office that keep people into account. And I know there was a conference also like in January. I think most of the sessions were recorded, so you can just check and also hear some of the interesting discussions that were on that line. So now over to what has happened in Kenya and our finalist of this hackathon, which was the Wheels for Life. And Wheels for Life, if just to take you down memory lane, Dr. Jemima Kariuki went to Twitter right in the middle of COVID and said, because she's now a final year resident in Obs Gyne at University of Nairobi. So she went to her own Twitter handle and was like, if there's a woman in need of assistance during this lockdown, please send me a direct message and I'm willing to come and see you and attend to you or assist you in your primary care services. And that tweet really blew up and she got a lot of people reaching out to her. So she went to her lecturers at the Obs and Gyne department at University of Nairobi, who are extremely supportive and very open-minded. And they told her, look, let's do this. Let's make this more formal. Let's get a platform where people can call in, can alert us, can tell us what services they need. Do we need to send an ambulance? Do we need to send a car? Or how do we get you to your point of care? And now, thanks to her lecturers at University of Nairobi, plus the Kenya Healthcare Federation, which has a lot of members in the private sector, and also a lot of development partners. We had now all these partners, about 10 of them, come on board to assist women, started off in Nairobi, get the maternity care that they needed. And this was, I think, this was the statistics of June 2021, where about 120,000 calls were received. This initiative is still running to date. And it's been highly publicized and it's still growing. And now even platforms like Rescue have expanded their scope of maternity services to counties like Homa Bay. So I think One thing I think is a key challenge we need to think about is most of these digital health innovations, they start off in capital cities. How can we expand our reach to the hard to reach places which actually need these services more? The likes of your counties, maybe even like the likes of Marsabit, Isiolo, Kisumu, Homa Bay, not just the cosmopolitan cities, which you probably jump to, maybe Nairobi, Kisumu, Mombasa, but more counties, because many a times we focus on the bigger counties, but it's the smaller counties that need these digital health innovations and interventions the most. We have 47 places where our digital health solutions can work. Another thing that happened, but this was way back when I was in medical school, and it's not really part of Women in Global Health, but something also worth noting, especially for the students here, is in around 2017, there were a group of final year medical students who, at that time, the PEDS protocol had just been released, the first edition, 2016. It was in a hard copy. So they thought of coming up with an app and putting this PEDS protocol in an application to make it easier so that whenever they don't feel stranded when they forget their protocol in the hostels. And again, they approached the University of Nairobi Pediatrics Department, and Kenya Pediatric Association supported them through the Ministry of Health in creating that application. So this is my call to action to any young person here. We all have amazing ideas. How can we take these ideas into impact? Sometimes as young people, we like shooting ourselves in the foot saying we can't do anything because we don't have funding, but there are people in this society who can support us and give us a leg up to ensure that our brilliant ideas get the scale up that they need. And it's not just a matter of finances, but also people in positions of influence who can expand your ideas to national and even global scale. Another one, but this is now in a different country, it's called Clafia, and this was now the one that won that particular category of the platform. It was now connecting patients in semi-urban and rural areas to now community health workers for home-based care. And they are the ones who won now $20,000. I think Jemima won 10,000, and that's still a win because I mean it's the African continent that had top 2 positions. So a win is a win at the end of the day. So I think in conclusion, I leave you with a quote, especially now that the COVID waves have fizzled down, but we're still in the era of trying to develop our global health security, from the founder of Women in Global Health and Executive Director, where she says that Women in Global Health, our mantra is global health security. And while women provide $3 trillion of care annually, half of it is unpaid because it's normally in informal systems. And we need to have a social contract for these women that recognizes their contributions. So one of the solutions we can do this to increase the investments in health and remuneration is by having digital platforms that can be an avenue of economic empowerment and also growth of individuals and communities. So with that, I'd like to say thank you. These are the overall handles for Women in Global Health, Women in GH. For Kenya, it is WGH Kenya on Instagram and Twitter. Thank you very much. And for our email, it's WGH, the same ending, at womeningh.org. I'll also post it on the chat, plus a link to the article on the hackathon. Thank you.
Thank you, Doc, for sharing that and all the amazing innovation that have been done before, and also challenging us to take up such initiatives. And I like that you've highlighted some of the initiatives that we can take, be it taking up space in the digital space rather, through blogs and social media, and also creation of apps or whatnot. And I'm glad we have Winnie from Vilgro Africa. They're an incubator. So I'd really like to understand. And I'm also urging you, if you have any questions, kindly just, you can raise your hand or put them in the chat box. Winnie, in your areas of work as an incubator, maybe if you could help us understand how Vilgro operates, what kind of ideas do you incubate, and how can youth be involved, especially now in terms of the digital space and innovation in general and technology?
Thank you, Marion. So here at Vilgro Africa, we look at very uniqueness in their technology, in their innovation, And we actually encourage a lot of women to apply. We actually had a call about women and gender lens, that we were encouraging women to actually apply. And we've been doing this for some time and having to emphasize on women and technology to be part of our incubation and support them however possible. So how Will Grow works is in regards to taking up startups, we tend not to have, because you might have a startup, but you haven't really like looked into it in terms of the growth of your solution, how it is. So we kind of not take a very, very, very early ideation startup, which is at a very ideation stage. We encourage the application that comes into our platform to actually be at a stage that the solution is something that is working. It has also shown some improvement in terms of the innovation is acceptable, and the problem is being addressed is something that is very crucial to the environment, especially in the healthcare space. So here at Vigor Africa, we do accept any kind of application, whether in the medtech, whether you're providing a service, whether you're just looking into the aspect of innovation around supply chain management. You are really highly encouraged to apply. But what key thing that we look into is basically your innovation and what the business aspect of it has to come in play. That's why in my presentation I emphasize this on the business aspect, because if you're coming up with an innovation, it's good for you to actually understand your business angle. So if you come into our incubation and we understand, of course, your innovation or your technology is very unique and you haven't really understood your business angle, we can be able to help you rectify and build up on that. That will not be an issue. But just to clarify that we don't take very early stage unless your solution has been identified, has been improved, has been approved that it's going to be sustainable at the end of it all. So I don't know if Marion have been able to answer your question or not.
Yeah, that is
rectifying. Okay.
That is well clarified. Thank you for that. And also, Dr. Marie-Claire has shared more about the hackathon on the chat, so you can be able to check that out. And maybe to you, MC, if maybe you could expound on any other opportunities that exist in healthcare, especially in terms of innovation and technology.
Thanks, Marion. I'm not sure that I think it still goes on. There used to be Fab Lab at University of Nairobi, which was to host hackathons, and they pair you with someone from College of Health Science, someone from the medicine degree, someone from computer science, and then depending on what topic it's chosen, whether it's something related towards agriculture, another field, then you're paired together. So your different disciplines working on a particular solution, and whichever innovation seems to be making sense goes up the ranks until probably development. I also know, I think Kenyatta University also had done a similar thing, and that's how there was an innovation during COVID that came up, and the student leader who was a medical student, the overall KU student leader, Bernard Karanja, Tibavent, that was it. He got recognition for it, including, I think it was a head of state commendation. So I think long and short, your universities actually do have some of these platforms where you can engage in innovations. But also aside from that, there are also private institutions that do innovations and hackathons, and not just hackathons, but also discussions on digital health and innovations. You have the likes of your dial-up, and there's another one, name slips me, that's been focusing on reproductive health of late. So right now, I think if you're comparing to, let's say, like 2015, 16, this was like Greek to discuss more or less, or looking for hubs to do this innovation incubations was a hard thing to do. But now there are quite a number of them, either nationally or regionally, or even online programs. I always say LinkedIn is your friend. You can find a place where you can plug in. So I think as we use our social media, we can use it constructively to find this platform where we can empower ourselves to be more into digital health. I think also Ponea, the platform, takes a lot of students to be like their interns, and then either staff or interns, and then you progress in the leadership. And I also think BioNH do the same. So I think it's just for you to, because digital health is very broad. You have everything ranging from telemedicine to teleradiology, to even I'll say telepharmacy with the MyDawa platform. So you can just, I mean, you lose nothing asking all these people whether they have a slot for you to do an internship for a few months and see how systems work.
Okay, thank you. I see a hand raised, Tabitha.
Thanks, Marion. I think I have a question for Marie. I think she mentioned something on the data collection, and just to know, like, moving to digital space, like, is there a safe program just in the collection of data that will help us, like, because I know this is something that a discussion that needs to happen, so that we have like all the data that are there in the, how do I put it, like patient data collection in a safe space. Because the issue with collection of data like digitally, I think, is the safety, because there's fear of losing information, or getting lost, or just getting in wrong hand. So is there like a safe program that is running that can be recommended for just collection of data for the purposes of moving to the digital health?
I think, are you asking, if you're asking me from our health management systems, like the systems that manage hospitals, all of them are ideally supposed to be safe. It's now when probably, and actually there's a ongoing research that shows most of these hospital hacks involve people who are involved in the development of the health management system, who kind of know where to hit you without you knowing. But I think long and short, if you're looking at it from the system, a system is ideally not supposed to be penetrable. So that it's being developed, these are the things that you look at. And that's what I was telling you, even having these internship opportunities in platforms like Ponea and BioNet, you get to see now how they work on it to ensure the data that you give when you sign up or when you see a doctor is secure from the time you put it in, or the time you see that consultant online, to the time the app gets the information to the lab, and so on and so forth. So I mean, this is something that is a work in progress. We have the Data Protection Act that has its regulations on how data should be stored, and it's something that's now gradually being implemented. There is the e-health bill, which is in, I think it's still in the reading stages, and some of these platforms took part in that engagement processes of making sure that it governs how e-health is done. As a medical doctor nowadays, KMPDC requires that if I'm offering healthcare on a telemedicine platform, I sign up and I say, this is my license number, I've renewed it, and this is how I'm going to offer services with this platform. So work is being done, but I think it's just a work in progress. And I think I'll just say, nobody ever designs a system for you to hack it. It's just unfortunately that people decide to hit on vulnerabilities.
Okay, do we have any other questions from the participants? Any other question? Okay, so if we do not have any other question, then I'd like to end the session. First and foremost, thank you, Dr. Marie Claire. Thank you, Tabitha. and Winnie for gracing this webinar and for your presentations. I hope we have all been able to get something out of this information session, particularly in terms of promotion of gender equity and also those interested in digital health. I hope you have been empowered to take up your spaces, especially be it in social media, be it in hackathons and many others. So thank you so much also to our participants for taking the time to join us today. I can see another link has been sent by MC. So you can also take your time to listen in on that. So I think with that, I'd like to wish you all a happy International Women's Day. I know we have guys, so happy International Women's Day to all the ladies in the room. So thank you so much for attending this webinar and have yourself a great.
Maran, could I just say something before you close?
Yes, please.
For all the men, please don't feel out of place, because I say mostly that we have wives, we have sisters, we have cousins, we have nieces, and getting into this kind of interactions, you're the ones to like open up this kind of discussions with them. So for the men that are here, thank you for joining us. This was a discussion open for everyone, because we know that having this interaction with you will make someone else get to know about the interaction. So yeah, so don't feel out of place. And thank you for taking your time and spending it with us. Thanks, Marion.
Yeah, thank you, Tabitha, for that. Also, you can feel free to, if you're not part of the Youth Voices Network, you can join the Youth Voices Network through the link that has been provided in the chat. Yeah, and also an opportunity to nurture your innovations through Africa Leadership and Vilgrow Africa. So thank you all so much and have yourselves a wonderful evening. Bye-bye.
Thank you, everyone, and happy International Women's Day to all the ladies in the room.
Okay.